This program is brought to you by Newsworks in cooperation with the City of Eau Claire.
Good morning. Thanks everybody for being with us and paying attention to this topic. We're all hearing lots of concerns worldwide and even in our community about coronavirus, the new coronavirus, which is called COVID-19. And things are rapidly changing. So we wanted to take an opportunity today to really have some time to pause in Eau Claire to say where we're at in this community in Eau Claire County and think about how to share with you what we're doing and what you can do as we move forward. First of all, I feel really fortunate as the Health Department Director to have an amazing communicable disease team and Health Department team working on issues like this. I'm also really fortunate, as you see behind us, to have amazing community partners. It's one of the reasons that I love working in Eau Claire County is that we work together and we get work done here. And you see that by everybody that came very quickly to show all of you that we're a partnership and we can only get this work done in incidents like this if we're working together. I want to start off by sharing what we know right now. Many of you are checking your phones regularly and looking at the news regularly, and it is rapidly changing. The official information as of yesterday, and again, this is changing very quickly, is that we know COVID-19 is a new respiratory virus. It started in China in December. Again, in December. It's a recent disease that we are learning about and responding to. It's spread to more than 70 countries worldwide. Most of the cases are in China, and it's estimated that we're close to 100,000 cases of the disease now in the world. Again, rapidly changing as testing is increasing. As of yesterday, again, CDC confirmed that there are close to 100 cases in the U.S. There is community spread between individuals in community in both Oregon State and in Washington State. And I think we all know that there have been deaths there as well. Yesterday, CDC reported that there are positive cases in 13 states and that there are at least 10 deaths in our country. One of the cases is in Wisconsin. We do have a Wisconsin case. 39 people have been tested as of yesterday, and 14 tests are pending. We also know that fairly recently, a week ago, the State Lab of Hygiene in Wisconsin was able to bring testing on board. So there will be more testing happening, and we know when we test for any disease that we will find more cases. So we are expecting that as we move forward. No one has tested positive in Eau Claire. Again, no one has tested positive in Eau Claire. The risk here is low. At this point, CDC and our community are trying to clearly communicate to people that those people that are at risk right now are those that have been in contact with someone with COVID-19. Again, contact with someone that's been ill with the disease is the risk. Whether you're a healthcare worker or you've traveled to a country or you've been in an area where there's community spread, that's the risk. People in Eau Claire right now should not be concerned. Today I got a phone call about someone that wanted to know if they could have ukuleles used because they were worried about spreading coronavirus. Again, yes, secretions will spread the virus if we have it here, but not right now. We don't have it in this community. Symptoms of the coronavirus, of COVID-19, are those classic respiratory symptoms, those things that for any cold and really for influenza that we see frequently. So cough, fever, difficulty breathing, respiratory problems. Typically it's been a mild illness and we don't hear that enough, but it has killed people and we know that. It also is more infectious. People can get it more easily because we don't have defenses against the disease because it is new. It is a brand new disease. It's not been in our community. So when we're exposed to it, we don't have a way to fight it off right now. We don't have a vaccine and we don't have specific treatment for this disease. Those are all things that are being worked on. We also know right now that there are travel guidelines. So CDC has put together travel guidelines. They're on the CDC website. There's clear information about how all of us should be thinking about travel, where we travel to and what we should do if we're traveling back from specific countries where there is coronavirus, COVID-19, and where that is spreading in the community. We really urge people, if they do nothing else when they consider travel, to look at that travel guidance. There are currently no restrictions for travel to most countries, and there are no restrictions for travel in the United States. Again, many people are bringing that up as a concern. I would like to just make a note to say, because we've seen this in the media and seen it in communities, that this is not a virus, nor is any virus one that discriminates. So this virus can be seen in any race, any ethnicity, any nationality. So I really want to make sure that people hear that and we pay attention to that. Again, if you're exposed to COVID-19, you are at risk, not for another reason. We haven't seen the spread of illness in Eau Claire. We haven't seen the spread of illness in Wisconsin. The risk is low, but it is changing. And we really, at this point, want to share with you what we're doing when and if COVID-19 comes to this community. First of all, for all of the partners in front of me, around me, I should say, the health and safety of residents in our community is really our highest priority. Whether the partner behind me is a school or a healthcare institution, that's all our goal, and that's why we work together on this. In public health, working on communicable disease is our bread and butter work. Yes, this is a new disease, but we do this type of investigation and control of disease with our partners all the time. Tuberculosis, measles, whatever disease you want to name, some very scary, that's our work. That's the work we do. We do have partners that are strong in this community. One of the advantages we have in Eau Claire is that we have a public health emergency preparedness committee that meets every other month. Partners behind me have staff that attend that meeting, and we have existing relationships. We are not newly getting together to talk about this disease. We have been meeting for years, planning for and responding to diseases together. And that's important for everybody to know. This is not something that we're scrambling now to figure out who are these organizations, how do we talk to you, how do we make this happen together. Responding to communicable disease is the health department's job, but again, we can't do it without partners. We also, as a team, are really working on public messages. So many of you may have noticed that we've put out a community letter, and that has been available broadly in the community as of yesterday, social media and through a network of outreach that we've done. We've also developed some very simple materials that people can use at their work sites with family members to post. So you may have seen an infographic or a poster, and we encourage you to share that. One of the things that we learned, and is a fun fact about how we get through these things, is our first infographic, when we talked about partnerships, had a little picture on it that showed people shaking hands, which is often a little icon that we use in partnership. Well, clearly, shaking hands might be not the message we want to send to people. So controlling communicable disease includes that contact to other people, and we should pay attention to that. So we changed the icon on that. Another really important job that we do is really making sure we are responding. We talk in public health about plans, and some people may say, well, stop planning, start doing something. Really, our plans, our public health emergency preparedness plans, and in this case, our pandemic plan, if we get to that stage, we have one in place. We are looking at it now to say, how is this different for this specific COVID-19 disease? And we are using that plan actively now as we respond. You may hear the word mitigation, that we are in the mitigation stage of our plan. That is where we are, and that means that we are working to make sure that the spread of disease is limited as much as possible. When and if we have the disease come to Eau Claire, that's our job. We are making sure that the fewest number of people get the disease possible. That's the work we do all the time. We also are working on those tools that we may need if we have the disease in this community, and we have to do some community measures to make sure that people are not exposed. Lots of questions are out there already about things like, how about closing schools? How about stopping big public events? Those kinds of things that we may have seen across the world and in places like Oregon and Washington. When and if we need to use those community strategies, we will, and we will work with partners on that. Our primary resource as we make those decisions, not only our team, the people behind me, but also the state health department and the Centers for Disease Control. There's clear information about how to do that, when to do that, and when it's effective, so that we're not doing things and scaring people. We really want to use the right strategies at the right time. We also are an incident command, so you may hear that term used. It may sound weird or scary, but what incident command is that when we have something that needs new attention and where we need to really pull in new players, we need some structure for that so that we do it in an organized way. And that's what we call incident command. So incident command means we have certain people with certain jobs, and our partners are funneled into that system in a really clear and specific way. We do have an incident commander for this issue, and that's Marissa Stanley. You may see her name as this progresses moving forward, and she is an important partner. She's a health department assistant director, and Marissa will really be that point person to make sure that we keep all the balls juggling effectively. We are working on this, our partners are working on this, and we really want you to know that that's being done in a coordinated way and with coordinated messages. What we don't want to have happen is that different people in the community are making wildly different decisions and confusing the public, and that's why it's so important that we have all of our partners around the table. So what can the general public be doing? No big surprise, and maybe not satisfying to some people, but common sense communicable disease spread measures. We don't want you to spread any communicable disease, including if COVID-19 comes to this community. We don't want COVID-19 to spread. So, again, to repeat those basic things, wash your hands. Again, wash your hands, and remember to wash your hands. If you are sneezing and coughing, do it into your sleeve. Don't use your hands. Cover your cough. And if you're coughing and sneezing, stay home if you're sick. Tell your employees to stay home if they are sick. Really pay attention to the fact that disease is spread by sick people coming into contact with well people. We want that to stop, whatever the disease is. Follow CDC travel guidance if you are someone that is traveling out of the country, and watch the guidance in case it changes. And really, in the end, we want people to keep healthy. This is the health department speaking to you. So do those things that keep yourself strong and healthy. Eat healthy, get some sleep. Do those things that keep you healthy. Not only when and if we have COVID-19 arrive, but for any disease. We do have influenza active in this community right now, and we don't want people to get sick and die from that disease either. We hope people stay up to date on the situation. We are really encouraging people to use reputable sources of information to stay up to date. The partner group behind me are all working together to make sure that we are sharing messages and keeping messaging consistent. Your primary sources of local information are two. So the health department website, which is coronavirus.echealth.org. Again, coronavirus.echealth.org. And then our social media sites, for those of you that use social media, and that's at Eau Claire Health. Again, we are sharing those messages broadly with our partners, so you will be seeing consistent messages, and our hope is that that will help people just understand that we are on top of things and moving forward. I really appreciate the media being here today. Having good, local, accurate information is critically important, so thanks for paying attention to this. And I also really want to thank the partners that are behind me and in the room. We can't do this work without that partnership, without those relationships. We count on each other to be available and working together, and that makes an absolutely enormous difference every day, but certainly when there are urgent issues that we may need to work on. Partners that are here today, just so you know, include the city of Eau Claire County, the city of Altoona, all of our Eau Claire School District and Regis, Case, and Altoona School District partners, including other schools as well, UW Eau Claire and CBTC, and all of our healthcare system partners. Obviously, this is a health issue, and having all of our healthcare system partners in this community are critically important. We are also working with all the other local health departments in the state and certainly in this region, and know that Eau Claire Health Department is not unique in this work. All health departments, whether you live in Chippewa or Barron or any of the other counties, are working on these same issues with their partners. So I'm happy to respond to any questions that people have. We are really hoping that today we're talking about community response questions, but we can open it up to that.
You said several times when and if the coronavirus comes to Eau Claire. Are you expecting the coronavirus to come to Eau Claire at some point?
Yeah, I think it's an important question. Of course, none of us have a crystal ball. This disease is spreading. It is in the U.S. I would not be surprised, and I don't think any of our partners would be surprised if we see coronavirus in Eau Claire at some point. When that is, we don't know, but we're prepared.
What's the biggest concern with the disease that still is relatively new, and not a lot of information out there from, your guys' perspective?
Sure. Question really is this is new, what's concerning? Any new virus is of course something that we learn daily, something new about and respond to. We know a lot about this disease. Coronaviruses are something that have that we deal with all the time. And even scary coronaviruses, SARS was a coronavirus. And again, we generally know a lot about coronaviruses. This specific virus, we're still learning. And I think one of the things that people are concerned about is how quickly it spreads because it's new. So that's probably the biggest concern and question at this point.
And then when did you guys all start working together specifically on this? Is it, kind of when it came out in December or more recently when it hit the U.S.? What's kind of the timeline of that?
Yeah, it's a good question. So when did we start working together? Again, we've had a pandemic influenza pandemic plan for years, well predates me being at this agency. And that's the kind of planning that's been done for whatever disease arrives that may spread rapidly like this. So this has been going on for many, many years. That plan has been in place and updated regularly for years. Health Department has been following this since the beginning, and you may not be surprised to know that we have teams of people that are listening to probably 3, 4, 5 phone calls a day to stay updated. That's one of our jobs, is to stay on top of the current information and make sure that we know what's going on. Partners have been working on this, at least I would guess, since January in their individual organizations. Certainly healthcare partners have. And then in the last month, we've been pulling the team more tightly together to talk specifically about this issue. So that's, for example, included a large group meeting last week, a number of meetings this week to talk about communication, to talk about response. It's included meetings that are coming up to talk about legal authority. So again, as we progress along the course of this incident, we will have more meetings, but the core basis of how we work together and the work we've been doing has been going on for years, again, primarily through that Public Health Emergency Planning Committee, but also through all the relationships we have. It makes us more confident that, yep, this is big and it's getting a lot of news, but this is the work we do.
Say someone calls the health department and says, I'm sniffling, I have a fever, I think I might have the coronavirus, but I haven't been in contact with any known case. Would the health department test in that case? Because we have heard of cases in Washington that from people who don't appear to have contact with known cases.
So again, the question is someone that with cold symptoms calls and says, I need to be tested, or should I be tested? Again, Eau Claire doesn't have any cases. We don't have any spread of the disease in this community. We have very clear protocols for when testing is required and encouraged as part of the process. That comes from CDC. It's based on science. The state and CDC help determine who gets tested when. Because we have no spread of the disease currently, we would not test that worried person that is ill, and that would be true of all of our healthcare partner organizations. Frankly, I would be much more concerned that they had influenza than anything else at this point. When and if that changes, we certainly will be working with our partners at the state level, at CDC, and at the local level to quickly implement those change testing guidelines.
About testing again, you touched on it a little bit earlier, but is there a way to test one virus here in Eau Claire, or is it just in the statewide?
Yep. Right now, as this disease started, there was lots of conversation about testing. The only place we could get test results from was from CDC in the U.S. We now have testing labs across the U.S., including 2 in Wisconsin, and those would be the 2 sites that tests would go to. We don't have that capacity locally right now.
Where are those?
In State Lab of Hygiene, which is Madison, and the Milwaukee Health Department lab are the 2 locations in Wisconsin. And they are running tests.
We've heard a lot about folks running out to stock up on water and hand sanitizer, running out to cast sponge and all this stuff. Is this something that you recommend people do right now, or, just kind of hold off and wait?
We absolutely don't recommend people run out and stock up really on anything. Soap might be something that you want to make sure you have a good supply of. Wash your hands is really our primary strategy for any communicable disease. Anything else people want to know? Yeah, thanks. So Dale just mentioned when we'll be doing regular updates. So as part of our process with Incident Command, we do communicate with all of our partnership group at least a couple of times a week using our Incident Command team process. So our partners get that update. We are updating very regularly the community as things happen. And the local health department website, the website that I mentioned earlier, is the place that daily, if there are changes, there will be updates. We do intend, if there is, when and if we have COVID-19 in this community, we will obviously be upping our regular communication, and we'll make sure that everybody does know about that. Our intent with our communications team for this specific incident, and many of those organizational representatives are behind me, that team is working together. They are meeting regularly and making plans for the weekly likely updates that will be coming out to everybody. All right. Thank you, everybody. And again, we appreciate people paying attention, and we really encourage you to go to the website for more information.
This program was brought to you by a cooperation between Newsworks and the City of Eau Claire.